Question 1. The high school nurse is presenting a lecture on sexually transmitted infections, STI, to a sophomore health class. Which of the following STIs is preventable by vaccination? B. Hepatitis B. Sexually transmitted infections, STI, are also called sexually transmitted diseases, STD. The CDC estimates that youth ages 15 to 24 account for almost half of the new sexually transmitted infections each year. Hepatitis B vaccine is administered at birth, 1 to 4 months, and 6 to 18 months. Older children and adolescents receive an initial dose, a second dose 1 month later, then a third dose at 6 months. Hepatitis A spread when a person unknowingly ingests the virus from objects, food, or drinks that are contaminated by small amounts of fecal matter from an infected person or source. Chlamydia and gonorrhea do not have vaccines. Question 2. A 1-month-old infant is diagnosed with developmental dysplasia of the hip, DD. The nurse anticipates that the healthcare provider, HCP, will prescribe which treatment? A. Pavlik harness. The Pavlik harness is a soft splint. It is most commonly used for treating infants with developmental dysplasia of the hip, DD. It keeps the infant's hips and knees bent, with the thighs spread apart. It can also help promote healing in babies with fractured femurs. In the majority of cases, the harness is worn 24 hours a day for 8 to 12 weeks. DDH occurs when the ball and socket hip joint does not form normally. The socket is a cup-shaped structure in the pelvis called the acetabulum. The ball, or head, is the rounded upper end of the femur. In DDH, the acetabulum is shallower than normal. As a result, the head of the femur does not fit into it well. The femoral head may slide partially out of the socket, sublux. A speaker cast is sometimes used for babies 6 to 18 months. Open reduction treatment happens between 18 months 6 years. Buck's skin traction is used for femoral fractures. Question 3. A 7-year-old child is being treated for nephrotic syndrome, NS. A trial of corticosteroid therapy has been prescribed for the child's initial treatment of NS. The nurse understands that the purpose of administering a corticosteroid is to A. Reduce proteinuria. Nephrotic syndrome is a condition where the kidneys leak protein from the blood into the urine. When it is untreated, children can often die from infections. Most children with INS respond to corticosteroid drugs, prednisolone. Corticosteroid treatment is often prescribed for children 1 to 12 years of age, when a kidney biopsy is not indicated. Criteria for corticosteroid therapy include 1. Normal kidney function. 2. No gross, macroscopic, hematuria. 3. No symptoms of infection of systemic disease. 4. Negative antinuclear antibody, ANA, assay. 5. Negative viral screens, i.e., for human immunodeficiency virus, HIV, hepatitis B and C viruses. 6. No family history of kidney disease. While corticosteroids can reduce inflammation, that is not why they are prescribed for NS. They can actually increase the risk of infection, as well as cause irritability and mood swings. Question 4. During a routine physical for a 15-year-old girl, the nurse notes the presence of Russell's sign. This is an indication of AN. B. Eating disorder. Russell's sign is the development of calluses on the knuckles or back of the hand, caused by repeated self-induced vomiting. The calluses are the result of knuckles making contact with the client's incisor teeth while inducing the gag reflex. Russell's sign is primarily found on clients with eating disorders, such as bulimia nervosa or anorexia nervosa. The other responses are incorrect. Question 5. The initial bolus of crystalloid fluid replacement for a pediatric client with hypovolemic shock is B. 20 milliliters per kilogram. With pediatric clients, fluid volume replacement is always calculated using the child's weight, to avoid fluid overload. Initial fluid bolus of an isotonic crystalloid is 20 milliliters per kilogram, followed by another 20 milliliters per kilogram if required. Question 6. A parent brings their 1-month-old infant to the pediatric clinic for a routine wellness check. The parent tells the nurse that when the baby spits up, it flies across the room. The nurse suspects that the infant likely has A. Pyloric stenosis. Pyloric stenosis occurs most often in babies under 6 months. In this condition, the pylorus muscles block food from entering the small intestine. It occurs more often in males. The NBSB, most common and NBSB, symptom and NBSB, noted and NBSB, in a baby with pyloric stenosis is and NBSB, forceful, projectile vomiting. It can lead to dehydration and weight loss. Babies with this condition may seem to always be hungry. The other options are incorrect. Steatorrhea, fatty stools, is the excretion of abnormal quantities of fat with the feces owing to reduced absorption of fat by the intestine. It is indicative of celiac disease. Intussusception is characterized by current jelly stools. Regurgitation is indicative of gastroesophageal reflux. Question 7. A first-time mother asks the nurse when she can stop worrying about her baby dying from sudden infant death syndrome, SIDS. The nurse knows that the peak occurrence for SIDS is C. 1 to 4 months. Although SIDS can occur anytime between the ages of 1 week and 1 year, the peak is 1 to 4 months, with 90% occurring before 6 months. According to the CDC, only 35 in 100,000 babies are affected by SIDS. Before the early 1990s Back to Sleep campaign, the rate was 130 per 100,000 infants. Infants learn to roll over at about 3 to 5 months. Question 8. The healthcare provider, HCP, prescribes a vaccination IM for a 6-year-old child. What is the most appropriate site for the injection? C. Deltoid. According to the CDC, for all intramuscular injections, the needle should be long enough to reach the muscle mass and prevent vaccine from seeping into subcutaneous tissue, but not so long as to involve underlying nerves, blood vessels, or bone. The needle gauge for intramuscular injection is 22 to 25 gauge. For most infants, 0 to 12 months, the anterolateral aspect of the thigh is the recommended site, with a 1-inch needle. For toddlers, 12 to 24 months, the anterolateral thigh muscle is preferred, and when this site is used, the needle should be at least 1 inch long. The deltoid muscle can be used if the muscle mass is adequate. If 2 vaccines are to be administered in a single limb, they should be spaced an inch apart. The deltoid muscle is preferred for children aged 3 to 10 years. 21. The needle length for deltoid site injections can range from 5/8 to 1 inch on the basis of technique. The anterolateral thigh can also be used. 23. In this case, the needle length should be 1 inch to 1.25 inches. For adolescents aged 11 to 18, the deltoid muscle is preferred. The anterolateral thigh can also be used. For injection into the anterolateral thigh, most adolescents will require a 1-1.5 inch needle to ensure intramuscular administration. The gluteal muscle should not be used for routine vaccinations. Subcutaneous is not an intramuscular site. Question 9. The pediatric nursing instructor is preparing a presentation on intussusception. All of the following statements should be included except A. It most frequently occurs in school-age children. Intussusception is a condition in which one segment of intestine telescopes inside of another, causing an intestinal obstruction. Although intussusception can occur anywhere in the gastrointestinal tract, it generally occurs at the junction of the small and large intestines. And NBSB. It occurs most commonly between the ages of 3 and 36 months, but may appear at any age. It occurs most frequently in the fall and winter months during viral season, and often about a week after a viral illness, such as a cold or the flu. The main symptom of intussusception is loud crying from severe, crampy abdominal pain lasting 10 to 15 minutes, alternating with periods of no pain. It is considered a life-threatening emergency and requires immediate intervention. Question 10. The nurse is providing discharge instructions to parents whose child has been diagnosed with a seizure disorder. The nurse is teaching them what to do when the child has a seizure. Which statement by one of the parents indicates a need for further education? C. I will restrain my child until the seizure stops. Restraining or holding a child down during a seizure is not an appropriate action. It can make the child uncomfortable and does not stop the seizure. Also, do not put anything in the child's mouth. This can injure teeth or the jaw. A child having a seizure cannot swallow their tongue. According to the CDC, the following actions are appropriate. 1. Ease the child to the floor. 2. Turn the child gently to one side. 3. Clear the area of anything hard or sharp. 4. Place something small and flat, pillow, folded jacket, etc., under the child's head. 5. Loosen clothing around the neck and remove eyeglasses. 6. Time the seizure. Call 911 if it lasts longer than 5 minutes. Question 11. Following a liver transplant, a 4-year-old develops an oral candida infection. The healthcare provider, HCP, prescribes nystatin. What is the best way for the nurse to administer the medication? C. Place half a dose on each side of the child's mouth. Oral candida, also called thrush, is a fungal infection in the mouth. Nystatin suspension is used to treat fungal infections of the inside of the mouth. A tablet, lozenge, troche, or pastille may be used for children who are older than 5 years. The nurse should place half the total dose on one side of the child's mouth, and the remaining half on the other side. Next, the child should swish the suspension around their entire mouth, keeping the liquid inside as long as possible before swallowing. Nystatin is given following food. No food or fluid should be taken for 30 minutes after administration. Nystatin is not an antibiotic, but in a class of antifungal medications called polyenes. Medications should not be mixed with food or formula. Question 12. An adolescent with a major depressive disorder, MDD, is admitted to the inpatient mental health unit. The nurse knows that compared to an adult with the same diagnosis, the adolescent will more likely display which symptoms? A. Physical complaints. Adults with MDD express emotional pain, while adolescents report more physical pain, such as headaches, stomachaches, or general malaise. Adults feel sad, while teens become irritable, impatient, and defiant. Adults may withdraw, while adolescents tend to keep a few close friends, change peer groups, or shift their focus to online activities. In a comparative study published in 2018, vegetative symptoms, appetite and weight change, loss of energy and insomnia, were more common in adolescent MDD than adult MDD. Anhedonia, loss of interest and concentration problems were more common in adults with MDD. Question 13. Parents bring their 3-month-old to the emergency department, reporting that during the last 2 days, the infant has experienced vomiting and diarrhea. On assessment, the nurse notes dry mucous membranes and a sunken fontanelle. Which of the following findings will also indicate a fluid volume deficit? A. Increased heart rate. Signs of dehydration include fever, increased heart rate, increased respiratory rate, and decreased blood pressure. Infants will seem listless or sleepy. The kidneys conserve water to minimize fluid loss, resulting in concentrated urine and high specific gravity. Question 14. The nurse is educating the parents of a 13-year-old girl with a new diagnosis of type 1 diabetes. One of the parents asks why their daughter can't take oral medication instead of doing injections. What is the nurse's best response? C. Injections replace the insulin her pancreas no longer makes. Type 1 diabetes, formerly called juvenile and NBSB, diabetes and NBSB, or insulin-dependent and NBSB, diabetes, is a chronic condition in which the pancreas produces little or no insulin. There is no cure. Insulin is a hormone required to transport glucose into cells. Clients with type 1 diabetes must monitor their blood glucose and administer insulin daily in order to stay alive. Oral medications are prescribed for type 2 diabetes, formerly called adult onset, to stimulate insulin production or help control glucose levels. Question 15. Fetal ultrasound shows the presence of transposition of the great arteries, TGA. Following birth, the surgical procedure to correct this defect is called? B. Arterial switch. In a normal heart, the aorta comes from the left side of the heart, and the pulmonary artery comes from the right side. In transposition of the great arteries, also called transposition of the great vessels, these arteries come from the opposite sides of the heart. And NBSB. In most cases of transposition, an arterial switch operation is performed. The arterial switch operation involves cutting off the aorta and pulmonary arteries just above the point where they leave the heart, and reconnecting them to the proper ventricle. The valve stays attached to the ventricle, so what was once the pulmonary valve is now the aortic valve and vice versa. Subclavian flap is one of the surgical methods for coarctation of the arteries. Pulmonary artery banding is performed to decrease pulmonary artery pressure and excess pulmonary blood flow. Surgical ligation is performed to treat patent ductus arteriosus. Question 16. A week after recovering from an untreated strep throat, a 9-year-old develops post-streptococcal glomerulonephritis, GN. When assessing the child, which of the following is an early sign of recovery? C. Increased urine output. Glomerulonephritis, GN, may develop a week or two after recovery from a strep throat infection. Post-streptococcal GN causes the tiny blood vessels in the filtering units of the kidneys, glomeruli, to become inflamed. This makes the kidneys less able to filter the urine. Children ages 6 to 10 are more likely to develop post-streptococcal glomerulonephritis than are adults, and they also have an GT, 90% full recovery rate. Increased urine output is an early sign of kidney recovery. The other options are general signs of improvement, not specific to glomerulonephritis. Question 17. Following an uncomplicated delivery, the nurse performs a physical assessment on the neonate. The nurse observes abnormally low set ears on the newborn. All of the following syndromes are associated with low set ears except B. Kawasaki syndrome. Kawasaki syndrome, also called Kawasaki disease, is a cardiac condition found in young children. Low-set ears are not part of the syndrome. Low-set ears and pinna abnormalities refer to an abnormal shape or position of the outer ear, pinna or auricle. Turner syndrome is a rare genetic condition in which a female does not have the usual pair of X chromosomes. Noonan syndrome is characterized by mildly unusual facial features including low-set ears, short stature, heart defects, bleeding problems, skeletal malformations, and other signs and symptoms. In Potter syndrome, the primary problem is kidney failure. The kidneys fail to develop properly as the baby is growing in the womb. The kidneys normally produce the amniotic fluid, as urine. Question 18. The nurse is preparing parents of a 7-month-old to give their baby finger foods. Which of the following is appropriate for introducing finger foods? D. Bananas. At about 7 to 8 months, a baby will begin to have an NBSB, the dexterity to pick food up, release or mash it. They will become more efficient and independent and NBSB, as they master and NBSB, the pincer grip around 9 months. Finger foods to introduce include cereal, scrambled eggs, small pieces of pasta or bread, finely chopped soft vegetables, and fruits like bananas, avocado, and ripe peaches or nectarines. The nurse should instruct the parents to avoid round, firm foods like carrots, grapes, and hot dogs and skip anything like raw veggies and peanuts. Raisins and popcorn are dangerous for babies. Question 19. The community health nurse is preparing a presentation for caregivers of children with sickle cell disease, SCD. Which of the following education points should the nurse include? D. Ways to reduce crisis events. While there is no way to completely prevent sickle cell crises, helpful measures include 1. Avoid temperature extremes, 2. Get enough oxygen. 3. Drink plenty of fluids. 4. Treat infections promptly. Opioids may be necessary to manage the pain of SCD. Anticoagulant therapy does not prevent sickling. Question 20. EMS transports a 3-year-old who has sustained severe traumatic injuries and is in hypovolemic shock. What is the best way to rapidly infuse fluids and blood products into the child's circulation? D. Intraosseous access. Initiation of IO access is indicated in adults, children, infants, or newborns in any clinical situation where vascular access is emergently needed but not immediately available via a peripheral vein. The intraosseous infusion technique uses the medullary cavity in the tibia as a non-collapsible vein for parenteral infusion. It is indicated in a child in shock or cardiac arrest when 2 attempts to access peripheral vasculature have failed or when more than 2 minutes have elapsed in the attempt to gain access. Intraosseous IO access has been used therapeutically since 1934 and has been proved to be a safe, reliable, and rapid means of introducing crystalloids, colloids, medications, and blood products into the systemic circulation. IO needle placement is not an ultimate therapy. It allows administration of life-saving medications, fluids, and blood when intravascular access is vital. IO needles may be left in place in bone marrow for up to 72 to 96 hours. Question 21. A 7-year-old is being evaluated for type 1 diabetes. While taking the child's medical history from the parents, which question is most important for the nurse to ask? D. Has your child been wetting the bed recently? Bedwetting in a child who previously stayed dry all night can be an early sign of type 1 diabetes. Other signs and symptoms may include passing large amounts of urine at once, increased thirst, fatigue and weight loss in spite of a good appetite. The amount of exercise or sugary foods do not cause diabetes. The child is still being evaluated, so it is too soon for education. Question 22. The nurse is caring for a child with a documented history of conduct disorder, CD. Which behavior can the nurse expect to observe? D. Harmful aggression to others. Conduct disorder and NBSB is a severe condition characterized by hostile and sometimes physically violent and NBSB behavior and NBSB, and a disregard for others. And NBSB, children and NBSB, with CD exhibit cruelty, from early pushing, hitting, and biting to, later, more than normal teasing and bullying, hurting animals, picking fights, theft, vandalism, and arson. Arguing with or defying adults can indicate oppositional defiant disorder, ODD. Children with ODD are more likely to act oppositional or defiant around people they know well, such as family members, a regular care provider, or a teacher. Separation anxiety is indicated by excessive worry or fear without the presence of parents or caregivers. Children may have an obsessive-compulsive disorder, OCD, when unwanted thoughts, and the behaviors they feel they must do because of the thoughts, happen frequently, take up a lot of time, more than an hour a day, interfere with their activities, or make them very upset. The thoughts are called obsessions. The behaviors are called compulsions. Question 23. A parent contacts the pediatric healthcare provider, HCP, to report that their 4-year-old daughter has been wetting her pants since recently starting to attend preschool. The child had been completely potty trained at home. The nurse suspects that the cause of these new toileting accidents is D. Stress from a new environment. Stress can cause a child to experience temporary regression in toilet training. New situations, such as a new daycare environment, a new baby, or parental discord can cause stress and regression. Other causes for accidents include being too distracted to use the toilet, waiting too long before going, constipation, or a possible urinary tract infection. Different schedule and foods should not cause wetting accidents. Intentional wetting is rare. Type 1 diabetes has other signs, such as constant hunger and thirst, accompanied by weight loss. Question 24. A 6-month-old infant is being evaluated for failure to thrive, FTT. The most sensitive indicator of the infant's nutritional status is D. Weight. The underlying cause for non-organic failure to thrive, FTT, is inadequate nutrition. According to the Merck Professional Manual, weight is the most sensitive indicator of nutritional status. When FTT is due to inadequate caloric intake, weight falls from the baseline percentile before length, height, does. Reduced linear growth usually indicates severe, prolonged undernutrition. Up to 80% of children with growth failure do not have an apparent growth-inhibiting, organic, disorder. Growth failure occurs because of environmental neglect, e.g., lack of food, stimulus deprivation, or both. FTT is defined as decelerated or arrested physical growth. Height and weight measurements fall below the 3rd or 5th percentile, or a downward change in growth across 2 major growth percentiles. Question 25. A parent brings their 6-month-old son to the pediatric clinic for a routine wellness check. The parent tells the nurse, "My baby still has a soft spot on the top of his head. Is that normal?" What is the nurse's best response? D. It can take up to 18 months for the fontanelle to fully close. The spaces between the bones that remain open in babies and young children are called fontanelles, also spelled fontanelles. Colloquially, they are called soft spots. These spaces are a part of normal development. The anterior fontanelle, on the top of the middle of the head, closes between 9 to 18 months. The posterior fontanelle, in the middle of the back of the head, closes at 1 to 2 months, although it can also be closed at birth. All cranial bones remain separate for about 12 to 18 months. They then grow together as part of normal growth. They stay connected throughout adulthood.